I didn't see where it said producer and host Tom O'Connor.
You just didn't see copy that said producer and host, Tom.
Like it used to.
We did the other
I mean, we'd have a show, we'd know the guest, but we wouldn't know who was hosting it.
Like, who's that guy?
Good evening and welcome to Viewpoint, the show with an attitude. Today we're going to be covering a subject that you've probably not heard of, or maybe you have. It's the issue of multiple chemical sensitivity. And my guest and I will discuss the symptoms and the illness in as much depth as we can. We're not looking at this from the perspective of a professional or medical professional. We're looking at this from the perspective of someone who suffers from this illness, which impacts everyone who might have it a great deal, including in employment, housing, and daily interactions. My guest today is Kelly Teves, and she is someone who has this condition, as do many other people. If you recall some years ago, the issue of fibromyalgia was quite prevalent among people, and it wasn't recognized as an illness and therefore couldn't be covered by health insurance. Today, it is recognized as an illness and can be treated, and also is covered by health insurance. This ailment is similar in that it is not recognized, even though it greatly affects those who have it. Now, my guest today is Kelly Teves, who suffers from this, and we're going to talk about whatever aspects we can from her perspective. So without further ado, I'll introduce my guest, Miss Kelly Teves.
Hi, Tom.
How are you?
I'm okay. How are you today?
Okay, I'm glad to see you. Glad you could make it here.
Thank
Now
you.
tell me, what is multiple chemical sensitivity?
Multiple chemical sensitivity is a condition a lot of people suffer from, and it's becoming quite a bit more common these days due to the amount of toxic chemicals that are being used in our everyday products.
What kind of products are we talking about? I know I've heard, like shaving cream, cologne, fragrances, house cleaners, and all of that. Are there any others? There's probably a lot that I've left out. But what others?
There are quite a bit. There are also laundry detergents, fabric softeners, cleaning products, air fresheners, perfumes, colognes.
And what are the manifestations of this problem that you have with those chemicals, and how does it affect you?
Well, for me personally, I know the effects and symptoms are different between multiple chemical sensitivity sufferers, but in my situation, whenever I'm exposed to any of these chemicals, my airway immediately closes. I have difficulty breathing. As a result, it causes a domino effect of other symptoms, such as trembling, difficulty breathing. I also lose my voice due to the lack of airflow coming through my vocal cords. It also increases my heart rate and causes me to feel very dizzy to the point where I'm about to pass out.
Now, that sounds a lot like asthma in a lot of ways. Were you an asthma sufferer prior to contracting or coming into this stage of this chemical sensitivity?
No, I never was diagnosed with asthma in the past. I never had breathing problems before this manifested.
Okay. And do you personally know other people who have this?
I do, yes.
Uh-huh. And some of the ways it's affected you, I mean, your work, obviously with Angelic Affairs, but I mean, what specifically, if you have to avoid all these things, can you work in a regular job with other people and the like?
Unfortunately, I cannot work a regular job, and it was for that reason that I was pushed into opening my own business, Angelic Affairs, in order to have some sort of financial income to sustain some sort of a life. Unfortunately, working in an office like I had in the past prior to this manifestation, there were lots of triggers in the office space that prevented me from returning back to work. Everything from perfumes from coworkers to the ink used in printers and fax and copy machines to cleaning products.
You stopped short there. I thought you were going to go on. So let me just ask if some of the things that happen with you when you're out in public, if you go into an environment that has some of these chemicals that are prevalent. Let's say you go into, a coffee shop or something, and you use the ladies' room, and in the ladies' room there's some kind of deodorizer or the paper that's used in there has a scent to it. Are these some of the kinds of things that affect you?
Yes, they
So
are.
that there are certain places you can't go.
Precisely.
Okay, and even I imagine then that what's the most common thing that you run into when you're in the public, when you're going hither and fro?
The thing that affects me most often are perfumes worn by other people and
Perfumes,
colognes.
and I assume you mean colognes as well.
Exactly. Any type of fragrance. Body spray.
Okay. What about soaps?
Soaps, for the most part, because we use them as we're taking showers and it's being rinsed off of our bodies, don't typically affect me when worn by other people.
Now, are there other kinds of this sensitivity? I mean, is everything that you experienced by other people who have the same condition?
Yes, yes, by most people. For some people, their symptoms are a bit different. For others, such things as even essential oils will bother other people, whereas for me, it doesn't affect me the same way it does for other chemical sensitivity sufferers.
I was of the mind that those oils were made from natural kinds of things. I mean, is there something in the natural kind of oils that also causes a chemical reaction?
There may be. I'm not completely aware to my own personal knowledge. I'm just more aware of the products that affect me, which tends to be irritant-causing chemicals.
Okay. So for you, it manifests itself in closing of your airway, among other things. Do people who know that you have this ailment, do they tend to dismiss the ailment? And how so?
Some people have in the past. It's unfortunate because of this condition. I've had to essentially reduce my circle of people. Sadly, I'm very rarely invited to family events because it's just easier for them to live their lives as they have been rather than inviting me and finding a way for everyone attending the event to accommodate my condition.
I imagine it probably interferes with dating too, right?
It certainly does.
Because it seems that, over the years, most people, well, both male and female, men wear cologne to enhance their attraction to the opposite sex. But if someone were to do that, I mean, that would cause you a problem, wouldn't it?
Essentially, that would mean the date is over at that point.
Have you heard of any treatments for this? I mean, other than avoidance, what are the treatments that you've heard about, if any?
I haven't actually heard about any sort of treatments. What my doctors have been telling me over the years has essentially just been staying away from the triggers, which obviously is very difficult to do in today's day and age. I did come across through my own personal experiences that the vapors from medicinal marijuana actually works as a natural bronchodilator during my attacks. So whereas when I'm using an inhaler during an attack, it takes about 30 to 45 minutes for me to get back to normal, so to speak.
30 or 40 what?
Minutes.
Oh, I thought you sentiments. Go ahead.
Whereas with just one inhalation of medical marijuana vapor, it clears up my attack instantly, and I'm back to my quote-unquote normal self within 10 seconds.
And why do you think that is? I mean, that's interesting. I didn't know that about that. It's because there's no smoke with a ventilator, or
Right. The difference, I mean, with smoking medical marijuana, you're actually putting smoke into your system, which you don't want to do if you are suffering from a breathing disability.
Right.
But with the vapors of the plants from the medical marijuana, that is actually very healing. And what it happens is it works as a natural bronchodilator.
Meaning it opens
Meaning
the
that it
bronchial
opens
flow in the lungs and the arteries or whatever. I don't know how that works.
The bronchioles, it automatically.
Bronchioles, yes, the bronchioles, okay.
So
I knew it was the Bronx somewhere. Okay, let's see. What other questions I have for you? I've got a ton of questions. Have you heard of, one other person that I know who suffers from this condition talked about what they call RADS and 2As and other stuff like that. Are you familiar with that at all? RADS, RADs, or whatever?
Yes.
And what is that?
RADS is Reactive Airways Disorder Syndrome.
Reactive Airways Disorder
Syndrome.
Okay.
Yes, sir.
That's new to me too.
It is. Well, reactive airways is essentially what I've been diagnosed with. And what that is a a term that they diagnose people with who have had a sudden exposure to a high amount of toxic fumes in someone who hasn't had a prior history of asthma, which is my case. And with irritant-induced asthma, IIA, that typically occurs with patients and sufferers who work in environments where they're constantly being exposed. And after so many exposures in the workplace, they develop this condition called induced irritant asthma, IIA.
And that one sounds like mesothelioma or whatever. The exposes to asbestos.
Right, it's
and the
similar.
like, which restricts the airways and does that, and sometimes doesn't manifest until years and years later.
Exactly.
Normally, people who work in shipyards and other environments like that have been exposed. I probably have been exposed to it since I worked in the shipyard for many years. And there was a lot of asbestos material, but hopefully I don't get into that. So, how long have you had this? I think I might have asked you that before, but I don't remember because my memory's bad.
Ditto. I've actually had this, it'll be 8 years this coming March 20th, 2007.
And to your knowledge, does it also affect young people, children?
It affects people of all ages.
All ages.
Yes.
Okay. And as far as the development of, is there a movement on to try to get it declared an official ailment? I don't think that is the case right now. It's not officially recognized, correct?
No, not technically at the moment. I know there are a lot of groups out there in the country that are individually working to try to make some changes, but it's been relatively difficult. Medically speaking, my physicians have just diagnosed me with Reactive Airways Disorder Syndrome, but as far as treatment, there really isn't any treatment out there for it other than avoidance.
Okay, so is RAD recognized as an illness that's treatable and maybe covered by health insurance?
Well, it is covered by health insurance. The problem is finding doctors and medical staff who are familiar with the condition and have general ideas of how to work with it and how to treat it. Unfortunately, with the doctors that I've been seeing, a lot of doctors try to just automatically classify it as asthma.
Right.
Which is different, unfortunately. You know, the symptoms that we have is similar to asthma patients, but the treatments are different.
So tell me about some of the treatments.
So for asthma sufferers, typically the usage of an inhaler of albuterol.
Okay, but that doesn't apply to what you're experiencing.
Right. With an asthma patient, it works for them practically instantly, whereas for someone like me, it doesn't work. It actually takes a little bit longer for the medication to kick in and take effect. Okay,
so the medical marijuana aspect, how long has that been in play? You've been diagnosed for 8 years.
Yes.
How long has that use or that treatment been in play?
I have just been personally playing around with it over the past year through concerned friends.
Oh, okay.
Who felt it would be beneficial.
So it's self-medication?
Yes.
And we don't want to reveal how you come about acquiring that treatment because it's still not necessarily, it's still frowned upon by certain people in the medical community, correct?
Precisely.
Okay.
Though it is becoming more recognized throughout the country. I know there are 14 states that have legalized it for asthma and for breathing conditions.
That's interesting because normally you would think if you put something in your lungs and you have asthma, that it would restrict the airways, but doesn't appear to be the fact with medical marijuana or just the inhalers.
I was just going to mention that actually. Using the vapor of medical marijuana is essentially very similar to inhaling vapor from albuterol in inhalers, except that inhalers actually contain a certain percentage of another type of chemical, I can't think of at the moment, that actually induces asthma, hence why it ends up taking a lot longer for the use of an inhaler to take effect. Whereas with the medical marijuana, it's just the pure vapor from this healing plant that instantly enters your lungs and your bronchioles, and it automatically opens.
I don't want this to seem like an advertisement for medical marijuana or anything, not that I frown on that. Or I particularly do agree that marijuana does have many benefits, and it's becoming more and more pronounced and recognized as time goes by. But could you just tell us some of the experiences you've had when you've gone different places and what you've had to do to counteract? For instance, I can imagine that if you went into let's say a coffee shop, and you went in there and someone was wearing a great deal of perfume, and you were sitting at a table, and would that how close proximity would that person have to be to you in order for you to be affected?
You know, it all depends on the perfume and the product that that person is wearing, and how much of it that they're wearing at the time. For some people, they could be as far away as, let's say, 20 feet or 30 feet, and depending on how much perfume they're wearing, the moment it enters into my airspace and into my system, I react instantly within seconds. At that point, I have no choice but to pack up my things, leave the building, or go to another place within the building where the air is much cleaner and where the perfume hasn't gotten to yet. Sit down, use my inhalers, and drink some water, and just hope that it passes.
So almost immediately, and that restricts your airways almost instantaneously.
Instantaneously.
Okay.
And what makes that
would
even...
cause you to have to, like you said, get up and move or get up and leave. You know, that's got to be very, very draining.
It's exhausting.
Yeah.
And it's unfortunate because in my case, one of the symptoms I develop almost instantly is losing my voice. So I can't even approach these people to explain to them what's happening. Some people have actually come up to me and said, "What's wrong with you? What's going on?" And they're the ones who are wearing perfume, and I have to essentially whisper to them that what they're wearing is bothering me. It's triggering a really severe asthma attack, and I have to leave. And then sometimes they give me a very snarky look. They say, "I'm not wearing anything." Other people will want to sit there and ask a bunch of questions about it. But at that point,
While they're wearing the offending chemical.
Yes.
Right. Now, have you had the experience of people actually wearing these chemicals after they're aware that you have a sensitivity to it, and possibly trying to induce you into some kind of reaction? Have you had that experience?
I certainly have. I've had that happen with former friends who thought, maybe if I just don't tell her I'm wearing anything, she won't notice. And they would wear it and it would trigger an attack immediately. I've even had the experience with some people in the past, not to specify whom, who have actually used this disability, this situation against me in order to get me to, quote unquote, be quiet.
I suppose a real skeptic could say that you're paranoid, but the physical reaction that you have is not psychosomatic.
It is not, and I've realized, and I've proved that to doctors and to people over the years, that, for example, when we're sick, it's very difficult for us to smell anything. So there are times where if I'm having a very severe cold and I'm exposed to a trigger, my body still responds. Even though I can't smell what's in the air, it is automatically triggering an attack. And at that point was when, we're all realizing, okay, this isn't psychosymptomatic. This is my body's natural response to chemical exposures.
Now, within your family, I imagine you have like times when you have family gatherings, let's say Thanksgiving or something like that, and how do you control that environment? You just don't attend?
What's been happening most recently is I'm just not even invited anymore. But for example, the last event I was invited to was a bridal shower with over 200 guests. And the moment I walked in, of course, for a special event, people are accustomed to getting dressed up and wearing perfumes. The moment I walked into the building, I was already being triggered by people's perfumes. They had baby wipes out on the table. Those were triggering an attack as well. At that point, I really had no choice but to sit outside by myself as the party went on indoors.
Well, that's a lot to endure, and being isolated from the family and other people and gatherings and all of that. So it's a very sad thing to deal with. Now, you don't get invited to some things. When you do get invited, you go in and you get exposed to something and you have to run and get away from it. Now, does the same thing happen when you like go in public transportation or something like that? Do you use public transportation?
I do not use public transportation because of that fact.
Okay. Well.
And when I do, for example, when I'm flying someplace for work, that's always quite a challenge.
Now, what do you do to prepare for that? I mean, you bring a face mask or anything like that, something that would block the scent or whatever?
I actually don't wear masks. I have used that in the past, but the chemicals still enter the pores and still trigger the attacks. So when I do fly, I always notify the flight attendants beforehand that I need to be the last one on the plane. I need to be seated as close to the doorway as possible so that when the plane lands, I'm the first one off the plane. Because if I'm sitting, in the middle of the plane and we land, what a lot of people have a habit of doing is spraying themselves with perfumes to get them ready to see their friends and family members when they get off the plane. And being in a tight, confined space like that, where people are just, spraying perfumes, it's a very, very scary situation. And I've had experiences where by the time I finally got off the plane, I nearly collapsed they would have a wheelchair out there waiting for me with breathing treatments to help get me back to my somewhat normal self. And they would rush me out of the area at that point.
Yeah. So how are your family members dealing with this?
It's been a bit of a challenge, and they're still getting used to it. They've had to switch everything over to organic products. And in living...
When you say organic product, you mean in the fragrances and the soaps and all the different things that people use, but are there foods that affect you like that? For instance, a fragrant pizza?
Actually, no. Foods don't bother me, actually, fortunately.
Okay. Have you found anything in your experience, say with, you mentioned marijuana, with herbs or with certain foods like, like nowadays people prescribe natural cures for things, so you could have a detox of lemons and ginger and the like, and people have these kind of natural cures for a lot of things. Have you found anything that decreases the experience?
I have, actually. Vitamin D.
Vitamin D
has been helping quite a bit.
Yeah. Do you have to inject it, or is it in pill form? Or?
It's in a pill form. I take about 2,000 milligrams every day, and that's proven to be quite beneficial. So what the vitamin D does is it strengthens my immune system so that when I am exposed, the attacks don't happen quite as instantly as I'm accustomed to them occurring.
Okay. Well, is there anything we've left out that we need to talk about?
I I think they're pretty, well, I mean,
It's probably a lot to talk about, but just something comes to mind. Obviously, when you get the